What if the medication sitting in your cabinet or your dresser right now, the one your doctor gave you for your blood pressure, your mood, your hair, your prostate, or even heartburn, is part of the reason your erection has changed? Most men never think to look there. Listen, I'm DrRachael Ross, functional medicine physician, sexologist, and founder of the DrRachael Institute. And today we're talking about 5 common medications that research has linked to erectile dysfunction in millions of men. And when I say common, I really mean common. Some of these medications are prescribed to tens of millions of people a year in the United States. Blood pressure pills, antidepressant, hair loss medicine. These medications can affect blood flow, nitric oxide, testosterone, DHT, nerve signaling, desire, sensation, orgasm, semen volume, and the ability to stay hard long enough to finish. And the first one I want you to look for may be hiding inside another blood pressure pill. It's called Hydrochlorothiazide. You may see it on your bottle as HCTZ, but you may also see it attached to another medication name like lisinopril HCTZ, losartan HCTZ, valsartan HCTZ. See, a lot of men are taking it and don't realize that the water pill is the part of the prescription. And if you're a black man taking medication for high blood pressure, then there's a good chance you're actually taking it, because diuretics are commonly used because they work really well for blood pressure. The part many men are never told is that for many, this medication can interfere with the erection. I'm seeing this in men in their 30s, 40s who've started having trouble in the bedroom and never connected it to the prescription that they started a few months earlier. You start blaming stress, age, or low testosterone, or a fading spark with your partner, and the most basic question never gets asked: did this start after a new medication? And HCTZ is only one of the 5. The one that surprises almost everybody is a medication that you definitely don't take for your heart, your blood pressure, your mood, or your hair. You actually take it for heartburn. So stay with me, because I'm going to walk you through 5 common medications that may be impacting your sexual health, explain what they do inside your body, and give you a plan to protect your health and your sex life without playing games with your prescriptions. And before we get into the list, I want to give you one simple picture of how your erection works. Your erection depends on 4 systems working together. First, blood flow has to rush in and fill the tissue. Second, the hormonal drive, testosterone, DHT, thyroid function, overall metabolic health, all influence desire and sexual responsiveness. Third, nerve signaling. Your brain has to send the arousal message through the nervous system so the body knows what to do. And fourth is that vascular response, the blood vessels. This is where nitric oxide comes in. Nitric oxide tells the blood vessels in the penis to relax so blood can move in and stay there. Every medication on this list can interfere with at least one of those systems. And at the end, I'll show you how to find out which of these 4 systems may be aging fastest in your own body. Go and calculate your erection age. The link is below and the QR code is on the screen. So stick with me. That's number 5, HCTZ. This water pill, it lowers your blood pressure by helping your body get rid of extra salt fluid. Less fluid in the system can mean less pressure against the blood vessel wall, so blood pressure goes down. And for many people, that brings the blood pressure down. So that benefit does matter, but here's the trade that we never talk about. For some men, HCTZ can weaken the erections and cause ED. Let's talk about why. See, part of the problem may come from the drop in the circulating fluid volume. You have less volume of blood moving through the body and less to fill your erection with. Simple. So that changes how quickly the blood vessels respond to expand when you're aroused. Another part comes from the shift in the minerals like potassium, magnesium, and zinc, which your body uses for vascular function, hormone production, and nerve signaling. So the issue goes beyond losing water. Your erection system is losing some of the support it needs to respond. And if HCTZ is inside a combination pill, you may not even know you're taking that part that's most associated with erection changes. This is why I want you to look at the actual medication name on the bottle. Now, you should never stop a blood pressure medication on your own. Uncontrolled blood pressure can cause stroke, and the goal here is a better conversation, not a cancellation prescription. If you see HCTZ attached to another blood pressure medication, bring that up with your clinician. Ask whether there's a blood pressure option that may be better for your sex life. One family to ask about is ARBs, medications like losartan, valsartan, olmesartan. For some men, ARBs are easier on erections, and in some cases, sexual function improves after switching. Your clinician has to look at your blood pressure, your kidneys, your heart history, your potassium, and your other medications, but you deserve to know that these options exist. So HCTZ is the first of the 5 common medications that research has linked to erectile dysfunction. It's prescribed for a real medical reason, but it can still affect your erection system. Now, the next medication category is another blood pressure drug sitting in millions of medicine cabinets, beta blockers. This is number 4, beta blockers. These are heart and blood pressure medications like metoprolol, atenolol, propanolol, or carvedilol. Look for that olol at the end. These medications are everywhere. Metoprolol alone is prescribed more than 60 million times a year in the United States. What happens is beta blockers slow down the stress signal on your heart. They can lower your heart rate, reduce pressure, protect the heart in people who need them. They're really important after certain heart events, for some rhythm problems, for chest pain, for migraines, anxiety, and other conditions. But erections need blood vessels to relax and respond. Some of these older beta blockers can make that response less efficient in some men. And of course, sex is important. You may still feel attracted, but your body doesn't deliver the same firmness or staying power because you're on the medication. This is frustrating because it'll make you think maybe the problem is confidence, and maybe the issue is the medication is affecting your blood vessel response. A big mistake is assuming that every beta blocker works the same way. There's a beta blocker in particular called Nebivolol. It behaves differently because it has a nitric oxide supporting effect added to it. In some studies, men did better sexually on Nebivolol than all other beta blockers while still getting blood pressure control. If you're taking a beta blocker because of blood pressure, then you could ask, is this beta blocker the best option for me given what's happening to my erections? Would another beta blocker be more appropriate in this case? And please hear me clearly. Don't suddenly stop a beta blocker. It can stress your heart. These medications usually have to be changed slowly, medically, and weaned down. Okay? So far we've covered 2 of the 5 common medications that research has linked to ED, and both were blood pressure drugs. Now we're moving from blood flow into brain chemistry because the next category can affect desire, arousal, orgasm, and erections. SSRIs are number 3. These are antidepressants like sertraline, fluoxetine, paroxetine. You may know them by Zoloft, Prozac, Paxil, Celexa, Lexapro, and a lot of men are taking them. I mean, a lot. Together, these medications add up to well over 100 million prescriptions a year in the United States of America. For many people, these medications are life-saving. What happens is SSRIs raise serotonin, which can help mood, but when serotonin rises, dopamine is less responsive. And dopamine is responsible for desire, motivation, arousal, reward, and that feeling of wanting. That's why some men on SSRIs lower desire, delayed ejaculation, inability to finish. And for some men, the erection is only one piece of the problem. You may feel emotionally flattered, still loving your partner, feeling less sexually attracted to them, and it may be your medication. That may be why you're struggling to reach orgasm because it's delayed or muted. So this is one of the most common side effects in medicine. And it's one of the reasons people stop antidepressants without telling their doctor. So please don't do that. Stopping suddenly can cause withdrawal symptoms, mood crashes, anxiety, dizziness, insomnia, and dangerous mental health changes. The right move is to talk to your prescriber. See, some antidepressants are easier on sexual function than others. Bupropion, for example, is often discussed because it works through dopamine and norepinephrine rather than serotonin. Some men may need a dose adjustment, a medication switch, taking it at a different time, or adding a medication to protect sexual function. There's some early research on Saffron for SSRI-mediated sexual dysfunction. And Saffron, in a study, men took it for several weeks. And I would call it promising, not proven. See, Saffron is not a replacement for medical care. You should talk to your clinician about before adding it, especially if you take blood thinners, mood medications, or multiple supplements. But I did a video on Saffron that you can watch right here. Maca may also be worth discussing too when it comes to SSRIs causing ED. You think of Maca as a possible desire support tool, not a true ED treatment. But the deeper point is this: your sexual desire, your arousal, your sensation changing after starting an SSRI, it deserves a conversation. Don't let anyone reduce it to just stress without reviewing the medication timeline. Now you can see the pattern. We are talking about the 5 common medications linked to ED. Now we're moving into a drug that changes the major male hormone pathway, and we're usually using it for hair, for men who are losing their hair, and also for prostate issues. It's called Proscar or Finasteride. Sometimes men are taking it as a pill and sometimes a spray or a solution topically or even a shampoo. So it deserves a serious conversation because it changes a major hormone pathway. Finasteride blocks an enzyme called 5-alpha reductase. That enzyme converts testosterone into DHT, which is a stronger androgen involved in male pattern hair loss and prostate growth and muscle strength and sex drive. So lowering DHT too much can help preserve hair. It can also shrink prostate tissue over time, but DHT, if it's too low, will wipe out male sexual function. When that pathway gets suppressed, some men notice lower desire, weaker erections, reduced semen volume, ejaculation changes, orgasm changes, less genital sensitivity, or sexual response that feels muted. And from my clinical experience, finasteride-induced ED can be one of the hardest forms of ED to treat because the problem is often so much bigger than blood flow. You're dealing with hormone signaling, nerve sensitivity, mood changes, pelvic responses, etc., etc. So this is especially important if you're a younger man taking finasteride for hair loss. Hair loss can affect confidence, but not being able to have sex impacts everything. So ask up front, what sexual side effects should I watch out for when you're prescribed this? And are there any alternatives that I can try first? And if I develop sexual side effects, what is the plan? Because just stopping it if there's a problem is not really enough of a plan, because it takes months, sometimes years, for these sexual side effects to improve. Okay? And topical finasteride is not automatically risk-free either. If enough of it gets absorbed into your system, it can still affect and impact DHT the exact same way. So if you are considering finasteride for hair loss, ask about non-hormonal options first. Minoxidil, low-level laser therapy, platelet-rich plasma, scalp inflammation treatment, transplant, testing for thyroid issues, iron deficiency, vitamin D deficiency, insulin resistance, stress-related shedding. Look for answers before you go straight to finasteride, because the conversation has to be different. So we've covered 4 of the 5 common medication categories that research has linked to erectile dysfunction. We've done the blood pressure pills, antidepressants, and finasteride for hair loss or prostate symptoms. The final one surprises men because it does not sound sexual at all. It's a heartburn medication. Number 1 is the medication that surprises men the most. I'm talking about proton pump inhibitors, PPIs, like omeprazole, Prilosec, Prevacid, Protonix, Nexium. See, these medications reduce stomach acid, and for the right person at the right time, they can be very helpful. If you have severe reflux or ulcers, Barrett's esophagus, or certain GI conditions, your doctor may have a really good reason for keeping you on one. The concern is how many people stay on them for years without anyone asking whether they still need them. Omeprazole alone is prescribed more than 50 million times a year in the United States, and some of it you can just buy over the counter. Pantoprazole adds more than 10 million more prescriptions, so this is not a small group of men. Now, how could a heartburn pill reach your erections? Well, one pathway involves nitric oxide. Your body supports nitric oxide in more ways than one. One route comes from your blood vessels. Another route comes from your food. And when you eat nitrate-rich foods like arugula, spinach, celery, beets, the bacteria in your mouth begins converting those nitrates. And stomach acid helps process that to continue it. If you block stomach acid long-term, that food cannot convert into nitric oxide. Some research also suggests that PPIs raise ADMA. That's the compound that interferes with nitric oxide production. So a pill that you take for reflux may be affecting the same vascular or blood vessel pathway that your erection depends on. The practical question is simple. Do I still need to take this? Is there a step-down plan if I don't? See, some men can reduce reflux by changing meal timing, losing some weight around the belly, reducing late-night eating, limiting alcohol, identifying which foods trigger it, and improving gut motility and treating constipation. Some can step down to a different medication under medical supervision. Some can use supplements. Some need to stay on a PPI because the risk is real. But you have to support your nitric oxide pathways. So move your body daily, build muscle, improve sleep, breathe through your nose when possible, address mouth breathing and sleep apnea if they're present, protect that oral bacteria in your mouth by avoiding strong antibacterial mouthwash around nitrate rich meals. And yes, eat your greens, but just understand that if your stomach acid is suppressed because you're taking one of these, the full nitric oxide benefit won't be there. So even heartburn medication can matter because erections depend on connected systems, blood vessels, hormones, nerves, digestion, sleep, metabolism. So those are the 5 medications that are interfering with erectile function worldwide. Now let's put the plan together. We've covered 5 common medication categories that research links to ED, and I've seen it clinically. Hydrochlorothiazide, HCTZ, and other thiazide water pills, beta blockers, selective serotonin reuptake inhibitors, SSRIs, or antidepressants, Finasteride, and proton pump inhibitors. The larger point is simple. If your erection changed after a new prescription or a dose change, the medication timeline belongs into the conversation. The goal is to make sure your sex life is part of this medical conversation. Here is what I want you to do. First, check the actual names on the bottle. Don't just look at the brand. Look for the hidden combination names. Second, write down when your erection changed. Did it happen after starting a prescription or increasing a dose? Third, do not stop anything on your own. See, blood pressure medication, beta blockers, antidepressant, finasteride, reflux medications, they all need a plan, okay? Fourth, bring these targeted questions to your next appointment. And fifth, support the system your erection depends on no matter what you take. That means better blood flow, better nitric oxide, better sleep, better blood sugar, better hormone signaling, better pelvic function, and better vascular health. Your erection is one of the earliest signs that your blood vessels are struggling. The blood vessels in the penis are smaller than the blood vessels around your heart, so changes show up there first. Pay attention to that signal, and if you're trying to figure out where to start, don't guess. Start identifying which part of the erection system looks weakest for you. That's exactly why I built the E-Age Calculator. You can go to it for free right here using this QR code. If you're taking any of these medications and wondering whether your erection is aging faster than it should, so tell me, which one of these surprised you the most? Is it the blood pressure medication, the hydrochlorothiazide, the beta blockers, the antidepressants, the finasteride, the PPIs, or did none of this surprise you? I'm Dr. Rachel Ross. Go check your erection age and just scan this QR code or check the link in the description. Now, I want you to watch this video next because we talked about Saffron and I want to make sure you know how to use it.